Assalamu alaikum. The article of this week is titled The Incidence and Intensity of Postoperative Pain and Flare-Up Following the Use of Three Different Intracanal Medicaments in Teeth with Post-Treatment Apical Periodontitis. It's a randomized clinical trial done by a Turkish group and published in Clinical Oral Investigations in 2024. Postoperative pain and flare-up are among the clinical complications encountered during and after endodontic treatment, and one of the most important causes of postoperative pain is microorganisms that cannot be eliminated from the root canal or pushed into the periradicular area. And in retreatment procedures, although microbial eradication is mainly achieved by chemomechanical preparation, root canal medicaments may help to eradicate microorganisms from root canal. Therefore, the aim of this study is to evaluate the effect of chlorhexidine, calcium hydroxide, chlorhexidine and calcium hydroxide mixture as intracanal medicaments on postoperative pain and flare-up incidence and the frequency of analgesic use in teeth with post-treatment apical periodontitis. 120 systematically healthy patients met the inclusion criteria, which were patients between 20 and 65 years of age, patients who agreed to participate in the study, patients had not used analgesic or antibiotic in the last 7 days, those who have single roots and single canal, and asymptomatic teeth with previous endodontic treatment but with abscess, experience or pain in chewing, percussion history developed within last 12 months, and teeth although asymptomatic but with newly developed periapical radiolucency, or those with unchanged in the diameter of the lesion were included in this study. Patients were divided based on gender and age groups. They were randomly placed in the medicament groups to make an equal distribution of the type of medicament used. And all root canal treatments were performed by a single operator, and after removing the old filling material and performing instrumentation and final disinfection protocol, first group received calcium hydroxide paste, and the second group received 2% chlorhexidine gel, and the third group received equal amounts of calcium hydroxide and chlorhexidine gel, and then the access cavity was sealed with glass ionomer cement. And for the postoperative pain evaluation, postoperative pain levels were evaluated for 7 days using VAS scale. And in addition to the documentation, oral examinations were performed on the 48th hour and at 7 days. Sensitivity on percussion, spontaneous pain, swelling of surrounding tissues, and antibiotic requirement were also examined and recorded. The results showed that there were no statistically significant differences between the distribution of the types of teeth in medicament groups. And when the correlation between age and postoperative pain is evaluated at 12 hours, patients between the age of 35 and 49 had significantly greater pain compared to the patients of 20 to 34 and 50 to 65 age range. There was no statistically significant differences at 3, 4, and 7 days, except for patients of 35 to 49 age group who had significantly more pain compared to patients between the ages of 20 to 34. Additionally, no statistically significant differences was observed in the tested medicament groups when a periapical lesion was present, while patients with no fistula had significantly greater pain values after 24 hours compared to patients with fistula. And when the correlation between the apical extension of the primary root canal fillings and pain was evaluated, significantly greater pain was observed in the short and overextended groups at 24 hours and 48 hours compared to the cases with acceptable root canal filling levels. And finally, no statistically significant differences was found between the group in terms of VAS score when all the time pain levels were evaluated. So to conclude the findings of this study, postoperative pain and flare-ups do not seem to differ when calcium hydroxide, chlorhexidine, or their mixture is used as an intracanal medicament. And according to their findings, a similar degree of pain relief indicates that calcium hydroxide or chlorhexidine-based medicaments are clinically preferable in retreatment cases to limit post-endodontic pain and flare-up incidence.